1.7 million people. That's how many people utilize hospice care in the United States every single year.
It's a lot of people.
It is. And so why are doctors still a little bit reticent to recommend hospice services? If you're curious, today we are talking with Dr. Andrew Mayo of St. Croix Hospice about removing the friction from the transition from traditional medicine to hospice care. So if you're curious, stay tuned. Welcome to Mavericks of Senior Living.
We are delighted to have Dignity Hospice sponsor our show this month. Dignity Hospice of Colorado shares our passion and drive to serve humanity with honor, love, and care. They continually examine the way things have always been done and unceasingly improve the care they provide. As one of the largest privately owned hospice organizations in the state, Dignity's service offerings and consistencies have continually placed them at the top of the preferred provider choice list in many communities. Pro tip, they are one of the select few hospice organizations that offer 6 to 7 CNA visits per week. This, along with massage therapy and 1 to 2 RN visits a week, truly allows Dignity Hospice to provide exceptional care to their patients. Dignity serves patients and their families across the Denver area, from Castle Rock to Fort Collins. Dignity Hospice is a bright spot in the field of senior care in every sense of the word.
And welcome back. And we are on the 4th episode of Bright Spots. I mean, this is crazy. We've already done 4 of these. And really what we're doing here is we're highlighting the innovation, the forward thinkers, those disruptors that are truly not only providing a great service for those that are aging, but also really pushing that envelope forward.
Yeah, and thinking differently.
And just like the book Switch, written by Dan and Cheap Heath, it's really focusing on those positive moments. Mm-hmm. And with that, we are so excited and honored to bring on Dr. Andrew Mayo from St. Croix Hospice. Dr. Mayo, thank you so very much for joining us.
Well, thank you. I'm very happy to be here, and thank you for having me on.
And we were lucky enough to talk to you before the show about some things that you all are doing, and would love to dive in a little bit about your background. Let's share with our audience who you are and how you got to be where you are.
Well, I'm broadcasting live from I've always wanted to say that. I'm broadcasting live from Philadelphia.
Yes.
And I'm here because my father, who's 92 years old, is celebrating his 65th medical school reunion for the University of Pennsylvania.
Wow. That is so impressive.
Yeah. And
our audience about your family.
Yeah. Yeah. So my great grandfather was Charles H. Mayo, and he was the founder of the Mayo Clinic along with his brother. So Will and Charlie, you often hear about the Mayo brothers, started the Mayo Clinic. And their son, Charles W. Mayo, was my grandfather. And my father is Charles H. Mayo II. And my brother is Charles William Mayo II. And I'm, I guess, the first Andrew.
Andrew the first.
Yeah, so I'm the 5th generation of physicians in our family.
Wow! So you have medicine in your blood.
Yeah, it was
DNA. Yeah,
deep shoes to fill, and but hard to step out of.
Well, I think that says a lot, though. I mean, that service of medicine is not always easy, and it takes obviously commitment and dedication, but also the service to others who might not always want your assistance and guidance, right? And so I applaud and appreciate, obviously, the history and the work from, our physicians, and especially ones that really have begun to shape, as our conversation before, you've had such an impact on the way you look and approach the whole care philosophy. Could you share a little bit more about that component of care philosophy?
Yeah. So, I started out in family medicine doing the full spectrum of care with, delivering babies and working in the hospital and working in the emergency room and clinic. And then I was in family medicine for 18 years, and I was asked to help out in hospice. And I started attending the interdisciplinary team meetings where we have a physician, a social worker, nurses, all coming together to care for an individual patient. And I started looking at what made the Mayo Clinic great. And it was really this interdisciplinary care focus on a patient and providing them not only care for the physical being, but also care for the spiritual person and the social person. And that interdisciplinary care approach struck a chord in me. And I then went in, was asked to come in full-time with St. Croix Hospice as their chief medical officer.
Wow.
And when was that? How long ago?
Well, I started in 2011, and then in 2014, I came on full-time with St. Croix Hospice.
Wow.
So you transitioned from family medicine, doing anything and everything,
Exactly.
to hospice. What was that like, and what have you learned in that transition?
Well, I've learned that this is the place that I'm supposed to be. And I've also learned that, hospice is just vastly underutilized. And, there's a number of reasons for that. I think, as medical providers, we don't get the education on the end of life care. We don't get education on death and dying. And so it's hard for us. We're taught that disease and death is the enemy. And sometimes it's very difficult for us to take that step back and to say, we have a lot of things that we can offer or we can do to patients in the name of curing disease. But sometimes we have to recognize that more isn't necessarily consistent with a patient's goals or wishes. And we need to be better listeners to talk to patients about what's important to them with the time that they have remaining.
Do you think is it a society thing as well too, a mindset that we have as a society around this idea of maybe giving up versus finding the right support, or is that maybe reading too much into it?
No, I think that hospice, you often get that pushback, that myth that hospice is about giving up, and really hospice is about living the best life that we can with the time that we have remaining. And I think that that's a really important concept to understand about hospice, is that, yes, we do help people in the dying process in terms of palliating symptoms, but we also are focused on providing the best life possible with the time that they have remaining. And that's something different to each person. And each person has a story as to how they've come to be where they are, how they've dealt with their chronic illness, and how they want to spend the time that they have remaining. And that's where listening to their story and trying to tailor the care that we provide to what a person wants.
It sounds more like kind of a philosophy that I firmly believe is that you're treating the whole person. You're not just classifying them as this diagnosis, right? Like one of my big pet peeves is, I do a lot of work with Alzheimer's and dementia, is it's the dementia patient. I'm like, no. This is a person first that has this diagnosis. And yes, can it be scary? Absolutely. Is there challenges? Of course, but there are some really great things that we can do even with such a diagnosis. So, I've really tried to focus on person living with X, right? It's a person first, diagnosis second. And I feel like sometimes that gets lost.
Yeah.
And it's frustrating because I think, dying and death, it can be scary, right? But it also can be a time of reflection and the understanding that let's focus on those bright spots in life. Like my grandmother is currently in hospice care, and trying to talk to the family of, let's look at, she's been here 91 years. That's pretty freaking cool. Like a lot of people aren't that blessed. Let's cherish and honor those memories. Not she's on hospice now, but she's had 7 kids. She's lived an incredible life. She's been a nurse. I mean, the wonderful, beautiful things that she's done throughout her life. That is where we need to be bright spotting and highlighting, not maybe the months or the weeks she has left, right? That's what we need to focus on. And I think that gets lost. And it's sad that we kind of focus on that small moment in time when she's had 91 awesome years.
Yeah. Well, so, I think you really hit on something. There's a lot of healing that takes place in hospice, and it seems sort of counterintuitive to say that, right. But we're a physical being, but we're a social and a spiritual being. And that network of people that we've influenced over our entire lives are part of that care team and part of that group that hospice focuses on to help facilitate exactly what you're talking about. The memories, the relationships that, some may need repairing, and hospice can also facilitate that.
Absolutely. This is something that I think is important, is how do you look at that interdisciplinary team? You talked about it earlier. That was one of the big things you loved about Mayo and the Mayo Clinic and so forth. How does that kind of focus and benefit somebody when you bring in that social worker, that nurse, that doctor? What does that actually do or mean for a patient and a family?
Well, I think it's a safe, it's a safety net that you have this team of people who are coming in and addressing, do you have a will? Do you have, are these some of the things that we can help put in order for you? How are you doing from a spiritual standpoint? Is there anything that we need to address or can help facilitate conversations or contemplations? Or can we just be present? There's a huge part of healing with just presence. And we have volunteers that come into people's homes to spend time, to read, to talk. And that's a big part of what we do, is that presence.
Yeah, I think that is a really, really important part of hospice. And I want to address one thing and then come back to another topic. But family doesn't know what to expect when somebody goes on hospice. They have no idea. And then this whole team of people from hospice come in and say, we're here to help you. And for family, it can feel a little bit overwhelming, and they don't always remember who's who and who they're supposed to talk to and things like that. But there are so many different ways that hospice can layer on the care, that this is one of the things we really want to bring exposure to in our podcast. That one, it's not giving up. And two, that the people on the hospice interdisciplinary team that you mentioned are really sharing the care of your loved one, and in all aspects of life from a holistic perspective. So just really want to make that clear to families.
And one obviously thing we're here talking about is you guys clearly are definitely on the forefront of your desire to change and improve and always get better every day. What do you expect for the future of hospice, or where do you see it going?
Yeah, well, I think that, the underutilization. So my hope is that, we start to recognize hospice as part of the continuum of care, and that, that we're able to take that step back as physicians. And, I talk to physicians, and I've talked to physicians who say, I don't send people to hospice because every time I send a person to hospice, they die. And that just, it blows my mind. But,
it's what? That happens whether they go to hospice or not.
Exactly. And the thing is that, that just highlights how much education that we need, not only education for, physicians and healthcare providers about hospice, but also just as we're doing today, talking about hospice. And, I think one of the bright spots for hospice for me is a quote by Dame Cicely Saunders, which says, "You matter because you are you, and you matter to the last moment of your life." And wow. We will do all we can, not only to help you die peacefully, but also to live until you die. And that statement, to me, is what embodies hospice, and it's words not only for the people at end of life, but it's words of wisdom to us to live each day the best day possible. And I think that's a very powerful statement, and it means a lot to me, and I think it's good guidance.
And we're going to put that in the chat, because I think that that really resonated deeply with me.
As well.
That's very
Dr.
powerful.
Mayo. It's amazing, and it is true. When you refer someone to hospice, they're likely to die, but they're likely to die at some point in their life anyway. And this gives them the extra support. I have a brother who always says, you have a 100% chance of dying. Thank you for reminding me. What an amazing story you have, Dr. Mayo, coming from the medical side, the family physician side into hospice, and really helping to bridge that transition. And we hope to speak to you more often and
I kind of want to tease a little bit, though. I want to tease what we talked about what was that AI. Just tease a little bit about that AI component that you have begun to integrate, because I found it fascinating, if you could. And then we'll let you kind of wrap it up. But tease it a little bit for us, because we're going to get you back on.
Yeah, so we utilize a program, machine learning program or artificial intelligence called Muse. And the Muse program really helps us to identify patients who are transitioning to a more active phase in their dying process, and allows us to actually have an impact directly on their patient, on their care plan. So we can increase the number of nursing visits. We can make sure that a chaplain and a social worker are out there to support the patient and the family. So it's information that comes to us and affects how we care for patients directly to the positive. And it's an amazing, amazing technology.
And that is so cool.
Yeah. And like you had said earlier, think of it like another vital statistic. It's one more piece of data that helps you do it better. So we'll have you back on and talk more about that.
But Dr. Mayo, thank you so much for your time. Thank you for joining us live from Philadelphia. We do wish your father and your family all the best. That is so cool. He's at his 65th medical school reunion. So,
and congratulations
to him as well. And to you as well too, sir. Thank you so much. And we definitely look forward to having another discussion. And with that, we are going to be moving into our Maverick moments. And Catherine, why don't we start with you?
You're going to start with me. All right. I'm pulling up something that really resonated with me this morning. Okay. So I get these things in my email every day that are called Notes from the Universe.
Notes from the Universe.
Notes from the Universe.
I like it.
And Mike Dooley, you can Google him. Mike Dooley is the man, the genius behind these Notes from the Universe. Today's note was, little tiny dreams require little tiny thoughts and little tiny steps. Great big dreams require great big thoughts and little tiny steps.
Wait, read that last part.
Great big dreams require great big thoughts and little tiny steps. So dream big or whatever you're dreaming. The point is, take a step. And it is the little tiny steps that are going to change the world. And that's the fear that most people have, is they don't want to take that next step, or they think one step is not enough. And so that's really what we're talking about at the unconference, and what we talk about on the show all the time is take an action. It almost doesn't matter what the action is, because we know that a body in motion tends to stay in motion. Yep. So take an action, just take that first step. So that's my note from the universe. Thank you, Mr. Mike Dooley, for being the person behind the notes from the universe.
Cool. Mine's going to kind of go back to caregiving and millennial caregivers. I think we're something that's often overlooked. And I have a stat here. It's a little old stat, but I couldn't find the most recent one. It's from the National Council on Aging. It's a 2018-2019 stat. At that time, 1 in 6 millennials were caregivers. At the average age of about 27 years old.
Wow.
Yeah. And it was predominantly for people or someone living with Alzheimer's or dementia.
So for probably a grandparent, potentially a parent,
potentially a grandparent. But think about that number, a 27-year-old. Do we really have the resources to support that person? Because right now, a lot of our energy is put onto that sandwich generation. Not saying we shouldn't, but I think we have to look at another set of tools for someone that is maybe younger, that is supporting a grandparent, a parent, a loved one. Just like we talked about today. Giving them the resources for hospice, for home health, for different tools in their toolkit to enable them to not only live the best life for them as a family caregiver, but also as a person, and then for the person that their loved one are taking care of.
I wonder if intergenerational housing is part of that, if they're living at home and that's part of it.
It could be.
I know you have a couple of residents whose family members are younger, 27-year-olds, and they've been caring for their loved one for a really long time. I think that is fascinating. And I go back to, this is my 80s days, so I'm dating myself, but the just-in-time concept, just-in-time learning, and just-in-time care tips and advice, I think are really important for something like that.
Absolutely. Hands-on, in the moment, right? In the moment.
Right when you need it. And it's right there.
Yeah. How do you get it effectively and efficiently?
Yeah.
I think that's the key. But just something to think about as we look at the caregivers and the aging population and how we have to think through more of what is an actual care partner. I like care partner better than caregiver because it's a tag team, but I have to say caregiver when talking about stats because you say care partner and sometimes people don't know what that is.
But we have our dollar jar, right? When we use terminology that we're trying to eliminate.
All right. And as we kind of wrap it up here, we've got some big things happening and shaking here. The Collaboration Aging event is coming up here very quickly, very soon, September 27th and 28th in Denver, Colorado. But more importantly, May 15th, that is a huge day. You know why? Why is it such a big day? At least
early bird pricing ends. If you want to get the cheapest rate, now is the time. Get it done before May 15th.
May 15th. And go check out our social media. We've got the highlights at Collaboration in Aging of some speakers. We're going to have Kurt Kazanowski, Hospice Advisors, is going to lead a panel on the future of hospice. We have Charles Turner of CARE is going to talk about the
newest trends,
caregiving. And then we have Dr. Amy Dorr, who was one of the first to create a Bachelor's of Science in Aging Services to really ignite and invoke that desire for serving others as they age. And, I really think it's really important that we start tackling that now and seeing what we can do in the future here. So.
Absolutely. And we attract innovators. So if you're an innovator, come. If you are someone who wants to go to a conference and sit and listen to someone talk to you all day long, this is not the conference for you.
So we appreciate everyone. We will be back next week with Dr. Amy Dorr, actually, as another part of our Bright Spot series.
She's next week, yes.
So thank you again to Dr. Andrew Mayo and St. Croix Hospice. And then we wish everybody a wonderful weekend. Until next Friday.